and welcome. You're watching Health Talk session by Yashoda Hospitals. Joint pain can put a damper on your quality of life. It can make you dread grocery shopping and other activities, and it can keep you indoor most of the times. If you have recurring or chronic joint pains, you may think that joint replacement is the only option. However, you may want to explore other less invasive options to increase the longevity of the joints. So let's discuss in our today's episode what is joint restoration and how different it is from joint replacement. I'm Dr. Lakshmi, and joining us today we have with us Dr. Kirthi, consultant orthopedician from Yashoda Hospitals, High Tech City. Welcome, doctor.
Hello, myself Dr. Kirthi Paladugu, joint replacement and arthroscopy surgeon, Yashoda Hospitals, High Techs.
So to begin with, doctor, what exactly do we mean when we say joint restoration?
When we talk about any diseases, like whatever it might be, like it be a medical problem or a surgical problem, we consider them into two divisions. One is reversible, the other one is irreversible. Any reversible things, like either it can be the functional outcome or the functional changes or the structural changes. Whichever we can reverse, either it can be with the help of a medication or even with the help of the exercises or some balancing, ligament, not damaging the natural joint. Restoring any of those things is called as, we bracket them under the restoration. There are few structural changes wherein it cannot be reversed with any of the procedures, like non-surgical or even the surgical, wherein I am replacing the cartilage or restoring the cartilage or balancing the ligaments, repairing the meniscus. Any joint is made up of the structures, as we all know, two bones above and below. In between you have a cartilage and few soft cushioning structures and the balancing structures, they are called as ligaments. Any restoration of these structures to maintain the balance of the joint and get the best functional outcome out of it is called as restoration. When we are not able to restore the functionality of the joint, we have to replace the joint to get it back to the anatomical position, as well as the functional outcome has to be improvised by replacing the worn out parts. That is called as a replacement. This is the basic difference between restoration and replacement. And restoration can never be an alternative for replacement, and only the end stage disease which can never be restored or replaced, at that point we will be opting for the replacement.
Yeah, doctor, I think that's well explained what we mean by restoration or replacement. But what are the general causes that when we have to consider when a patient will be going for restoration or replacement?
So many of our patients come to us, common indication for any surgery or any rehab process is, first and foremost indication is pain. Patients who come to us with pain and who are not able to do their daily activities, something like who are not able to walk for 10-15 minutes, who are not able to stand for 10-15 minutes, or do their daily activities such as cooking or staircases, even going to the washroom becomes difficult for them in their day-to-day activities. In those situations, we have to assess what is the level of the degeneration that has happened. Usually what happens is, when I am standing, only certain part of the bone will be coming in contact with the counterpart of the bone, that is called as a weight bearing portion. The wear and tear happens only at the weight bearing portion. So on that weight bearing portion, if there is a wear and tear, from the non-weight bearing portion we can remove the cartilage and put it there. By that we are restoring that joint by making it pain free and giving it a more life. That is what is all restoration about. Up to the stage 3 we can go to an option of restoration. In stage 4 and above, wherein there is a deformity, there is an imbalance wherein we cannot recreate that imbalance by the retaining the natural structures. In that scenario we have to go for the replacement, which is a joint replacement. It can be the partial joint replacement or a total joint replacement. That is again based on the age of the patient, wear and tear, involvement of the joint. Only partially if the joint is involved, we have to go for the partial joint replacement. If there is a complete, all the three compartments of the joint is involved, then we will be going for a total knee replacement. That is how we define.
Yeah. I just want to know, doctor, if a patient undergoes restoration of the joint, is it a permanent solution or would they require replacement at some point or the other?
Restoration is not the permanent solution. As I already told you, restoration can never be a replacement for the joint replacement. It is a process, something like as an prolonging the process of degeneration. One simple daily usage kind of a thing, if you want me to give an example, by doing a wheel alignment for our car, it doesn't mean that our worn out tires are going to come back to brand new stage. We are giving the life for the tires which have been worn out. So wheel alignment is more important to give life for the tires. Similar way, balancing the ligaments or balancing the joint and restoring the joint is more important to give it a longer life, rather than thinking in terms of that I am preventing the replacement by doing this. At an elderly, it doesn't mean that everybody should undergo a joint replacement after a certain age. There is nothing like you have a warranty for this joint for so many years and all. It all depends on the lifestyle and how the wear and tear happens based on that. But in the end stage, if completely worn out and you have a severe deformity, which is a fixed deformity, wherein it is not correctable by any other processes, then the ultimate solution would be replacement. As you asked me, by doing a restoration, if we can avoid the replacement, that is not the answer. We can prolong the need for the replacement. That would be my answer for that.
Yeah, doctor. So talking about recent advancements, what are the recent advancements in the field of restoration or replacement of joints?
If we talk about the restoration versus replacement, they are completely different entities. The early stages, we are going for the restoration. If you ask about the recent advances, right from PRPs, we have been talking a lot about stem cell therapies, PRPs, bone marrow aspiration, cartilage regeneration and replacement of the cartilage, and even to a stage that now we have artificial cartilage replacements also. That is what we have come to a stage in cases of restoration. Before going to the cartilage damage and all those things, balancing the ligament is more important. So any ligamentous injuries or meniscal injuries, we have to repair them, give them the proper balanced joint, and based on that we take a call about further what can be done, what not to be done. And coming back to the replacements, and the buzz in the town or buzz in the society now is about robotics. Robotics is the most advanced thing what everybody would be talking about when we are talking about replacements. Definitely it's a feather in the cap doing a robotics. It is more precise, it gives you accurate measurements kind of a thing. Every step you can recheck when you are doing the process of replacement, and you can balance it very precisely, and you are rechecking what you have done on table. If any corrections to be done, it can be done at that point of time. If you ask me, is it an alternative for a conventional way? No, never an alternative. Robotics is not completely robotic, especially in orthopedics. It is a surgeon's brain and the mechanics of the robo which is going to work hand in hand. And there are certain indications wherein you have to do a surgery using robotics. There are specific indications for that. Definitely in those scenarios it will be helpful, and doing it in a robotic way would be the future probably, but it cannot overtake the conventional way of doing the joint replacements.
Yeah, doctor. I think previously you made a good point about lifestyle modifications to increase the longevity of the joint. So what are the steps that one can take for this?
The most important step, like it's not just the arthritis what we talk about, it's the muscular weakness or the structures around the joint which is being strained. They are the main causes for the root cause of the pain. And most of the patients do come to us telling that I have a clicking in my knee. If you talk any patient, any of your friends or your relatives, 30 to 40 age group, they come to you telling that I have a clicking in my knee. Do I have to consider about the arthritis and all? It's never arthritis, it's a maltracking of the joint what is happening. That is mainly because of the weakness of the quadriceps muscle. If the front side of the thigh we have a muscle called as quadriceps, any weakness to that will lead on to this maltracking, and that will cause the clicking. Clicking doesn't mean that you are having arthritis. So first stage of any joint restoration or joint health to be maintained will be the strengthening of the muscular structures around it. So first take home message would be start doing exercise. Once you start hearing the clicking, it's the time for you to start doing the strengthening exercises. Toning of the muscles and stretching is equally important, and a healthy lifestyle like losing weight or regular exercises, and even the calcium or vitamin rich food, all to be supplements to be taken, should be taken in a natural way rather than going for the supplements straight away. Whatever natural source of food are available, you can go with that. That is how it starts to be shortlisted.
So before ending this episode, doctor, what message you would like to give to our audience out there?
First and foremost thing would be like, don't be scared of your joint pains. And everybody will be a thought process like every joint pain should be undergo a surgery or something like that. Never surgery is a solution for all the joint pains. In our OP, we see around 40-50 patients every day with a knee pain or shoulder pain or any of these pains. Most of the pains they recover well with exercises. So initial phase, whenever stage 1 or stage 2, once you start up with the joint pains which are not subsiding in a couple of weeks or a month or so, please do visit your doctor, be regular with your exercises, have a healthy lifestyle so that you prolong the life of the joint. We consider joint replacements only when people are not able to do their daily activities, they are not able to stand for 10-15 minutes, they are not able to go to the washroom or something like that, and this is being done even after doing the exercise very precisely. The physio has been followed and the medications have been taken, and still you have persistent pain after a period of 6 months to 1 year or so. Only at that point of time, and even your exercises are showing that nothing can be done, there's no restoration which is possible here. Only at that point of time any doctor would suggest for a joint replacement or a surgery. Other than that, most of the patients, if they come in the early phase, probably we can prolong the life of the joint by doing sincerely our exercises and having a healthy lifestyle.
I think that was an eye-opening message, doctor. So thank you, doctor, for your interview. It was wonderful having you here on the program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative as far as joint restoration and replacement is concerned, and do join us for the next week as well. Until then, stay healthy and take care. Thank you.